Hello and welcome to today's webinar. Thank you so much for joining us on our discussion, or in our words, the impact of the overturning of Roe v. Wade on girls, young women, and gender-expansive young people of color. My name is Lisette Orellana Engel, she, her, ella, and I'm Vice President of Policy and Systems Change here at National Crittenden, and will be serving as your facilitator today. I had the privilege of working with the fellows and the amazing young people who took part in this discussion. To get started, please remember this webinar will be recorded, and we will start off with an introduction from Kalisha DeSuze-Figures, who's an advisor to this work. Kalisha.
Hi, everyone, and welcome. Thank you so much for joining us. I am excited for you all to hear and dig into this report, what we heard from young people across the country. But first, I just want to start with a little bit of a framing and a theory of the case of why this was important. We know last year we saw the overturning of Roe v. Wade and the Dobbs decision. Literally, as we have this call, abortion remains under attack in the courts, with last week a judge in Texas single-handedly making a decision to block an FDA-approved drug, mifepristone, that has been working safely and effectively and has been used for medication abortion for over 2 decades. And just in the middle of the night, we saw the Fifth Circuit continue to use power against any merits in a case to restrict abortion access. And so the theory of the case of why is young people are important in this moment. Girls, young women, gender-expansive young people. When we talk about the impact of these decisions, the impact of not having full bodily autonomy, we know it disproportionately impacts communities of color, but also disproportionately impacts young people who are going to face the brunt of those access restrictions. And so the theory of the case of why is because, this broader gender justice, reproductive rights movement in many ways excludes the voices of young people, those most impacted. And we also know that young folks have a lot to say in this moment about what these decisions mean for themselves, their lives, and their future. So this was an opportunity to hone in on the voices of young people and how they are responding to this moment, how they are fighting back in this moment. And it covers everything from thinking about reproductive justice and care and access, to thinking about mental health, to thinking about issues of criminalization, to thinking about issues of power and patriarchy. So we are just extraordinarily excited for you to hear these words and the findings from this report, and hope that you take with it a call to action to do more to ensure that as conversations around reproductive rights and justice continue, you are asking the question of where are young people, and what can you do to make sure that we're further centering young people in the discussion. So very excited to join you briefly just to frame, and I will pass it back over to Lisette.
Thank you so much, Kalisha, for that framing. It's especially timely today, just as you mentioned. So a few things, excuse me, a few things, housekeeping. We encourage you to practice self-care. Please leave your cameras off as you need to, or take breaks if anything comes up. Excuse me. Respect your pronouns. That's something always very important. All participants will be muted for today's webinar, but we do have a chat and Q&A section. So we encourage you to please put your questions in the Q&A section. They will be monitored. As we mentioned, the webinar is being recorded, and everything, including the slides, the report link, will be shared, and it will be up on the National Crittenden website. So National Crittenden is hosting today's webinar. We worked in partnership with fellows in this work. National Crittenden is an intergenerational gender justice advocacy organization with a vision of a world in which all girls, young women, and gender-expansive young people can achieve their potential and live unapologetic, liberated lives without fear of violence or injustice. Please feel free to visit our website to learn more about our organization, our vision, and our work. I'm very excited about the next hour and to introduce our panelists who will be talking about our findings today. Addison Moore, take it away.
Hello, everyone. My name's Addison. I use they, them pronouns, and I was an In Solidarity Fellow during the developing of this report, and I'm excited to be here talking about what we found in the webinar today.
Hi, my name is Chloe Williams. I am also a panelist, really excited to be with you all today. I am a former In Solidarity Fellow and was participating as a fellow in these conversations and was recently hired on board as a Strategic Vision Advancement Associate over here at National Crittenton. I've been an activist for the last 10 years. I have founded a mutual aid network here in Sacramento, California called Communal Care Project. I own and operate a artistic development project that focuses on platforming and celebrating the storytelling of women and gender expansive people of color. And I'm a published author. I'm very happy to be here with you all today.
Good afternoon, everyone. My name is Lanita Berry. I'm from Charlotte, North Carolina. My preferred gender pronouns are she, her, and hers. I am a person with lived experience in the child welfare system, where I began my unique relationship with reproductive justice since I was pregnant and parenting at the time. I am a former RJ Fellow and recently hired staff with National Crittenton, working in the policy and systems change focus area. And I'm glad to be here.
Thank you so much. And we also have on the webinar various staff from National Crittenton, and on our webinar team, we have Dr. Shakira Washington, who is Vice President of Collaborative Research and Innovative Thought, who is an integral part of the team in creating the report. And you heard from Dr. Kalisha D'Souza Figures, who is an advisor and a great partner in spearheading this conversation. So with that being said, we can go ahead and move on to the conversation. We will post the link to where you can access the report on our website, but as we mentioned, we will be sending the recording and the slides at a later date, and it will also be on our website for future reference. So why are we here? We want to kind of dissect a little bit of what we published on the report and explore the themes that came out from those conversations that took place late last year. The conversations took place over a few weeks over the fall. And after they were done, our fellows came together and they had conversations around what they heard. This came down to 8 themes: accessing abortion and reproductive healthcare services, powered patriarchy and inequities, criminalization and surveillance of accessing reproductive healthcare services, making personal decisions based on abortion rights, Dobbs decision rolling back other constitutional rights, impact on mental health and well-being, reproductive healthcare information, access, and education, and determination and vision for justice. So we'll get started with our discussion. Chloe, can you walk us through the methodology for this research and what was the research design and structure?
So this was a qualitative research project. So the primary method of acquiring data was facilitating conversations following our outreach. And these conversations, we had 12 in total that took place across 14 different states virtually. And we were able to reach over 115 girls, women, and gender expansive youth of color. And while we were going through these questions, they were transcribed and recorded. Later, we would code them and identify the major themes that we reviewed and get more into it as the report goes on.
Thank you. Lanita, how did you all approach outreach? How did you engage young people across states? And how did you choose the states that you focused on?
So our goal was to hold conversations in states that showed like a range of abortion and reproductive rights laws, which included expansive access, protected, not protected, hostile, and illegal. For the expanded assessed states, were California, Minnesota, New Jersey, and New York. Protected states and jurisdictions were District of Columbia, DC, Maryland, and Massachusetts. The not protected state was Virginia, and hostile states included Ohio and North Carolina. And the illegal states that we had hosted conversations in was Alabama, Idaho, Mississippi, and Texas. Within each state that was identified, we as a team outreach and connected to community organizations, individual stakeholders, and agencies to make sure that we had a well-balanced group in each conversation. We were also able to share out information with our partners, and they too also shared it with individuals. We were able to select participants based on a first sign-up basis with the limit of being 25 signups per conversation.
Thank you. Addison, what about this research process stood out to you?
So to me, what really stood out in this process is how involved youth were from the beginning till the report coming out. I think that it's very important when having these conversations, doing this research, to have the people who are being researched about involved in the process as well. So being able to help inform the questions and figure out where we wanted to go, what we wanted to do was really important. And I thought that it added on to the report one coming out for at least me as a young person, knowing that I was in the background as well as being in the foreground, seeing what the responses were, seeing myself in those responses, and knowing that we were there from the start to ensure that those responses were as thoughtful and authentic as possible.
Thank you for that. So this is a question for all of us. Ground us in the voices from the conversations. What was the most salient theme that you heard in the conversation series throughout?
I personally would say the theme that was most prevalent was the anxiety and distrust. I think that throughout this report, as you'll see as we go deeper into this webinar, there is a lack of trust between young people and their appointed officials and the government and the programs that we have access to, from being able to discern whether information is reliable, all the way up to being surveilled and criminalized for receiving services. There is a lot of anxiety and distrust that young people are experiencing.
Thank you. Anyone else can jump in, or it will also make room for questions. So if folks have questions, please, again, remember to use the Q&A function, and we'll break in between to answer your questions.
I'm sorry, if I could also add, I just think even more so than anxiety, I really think something that's come up a lot is fear, which I know that fear and anxiety can be grouped into the same category. But I do think it's very important that we are naming fear. I think that it is a glaring red flag that women and gender expansive people are fearing for the safety and preservation of themselves, their bodies, their autonomies, as well as their rights. And I think that the overturning of Roe v. Wade really instilled the reality of what a divide there is within government and progress in preserving the autonomy and rights of women and gender expansive people. And I think that it made this fight very real.
Wonderful, thank you. Well, let's dig into the findings and themes that you all gathered from these conversations and explore them a little bit more. Chloe, we'll go ahead and start with you. What did we learn about young folks' access to reproductive healthcare services?
Throughout the report, young people have expressed that the overturning of Roe v. Wade has had far-reaching consequences that not only impact their access to abortion, but other reproductive health services, and that includes Plan B, STI testing, gender-affirming care, and so on. Banning abortions doesn't stop abortions, it just makes them inaccessible and unsafe, which I would like to take a minute to put a huge emphasis on. Like, there is no way to stop abortion. It's something that is going to continue, but having access to safe and accessible abortion is absolutely imperative. Making decision to have an abortion is already difficult, and the laws in place have only added further stress, more obstacles, causing additional anxiety and trauma that is just kind of piling on top of the stress that young people are already feeling. We also found that the reversal of Roe v. Wade has resulted in reduced access to the dependability of local women's health clinics, which have either closed down or faced scrutiny and attention. And consequently, young individuals have had to explore an alternative. And I had a quote that I had pulled just to kind of support some of these findings. Recently, I've gone to my recent pharmacies and I have seen that the shelves for items related to reproductive health care are completely empty. You literally have to go and ask somebody, which I mean, even the implications of that are just wild, because you have to go and have a conversation with another person about getting something that normally you would just be able to pick up off a shelf. And that quote was from California, which is one of the just like relatively lesser impacted states, but Mississippi, which is much more regulated and much more restricted. There is a quote that said, "I'm from Jackson, Mississippi, and the Jackson, Mississippi Health Organization was the first place I would go to receive STI testing. Last month, I tried visiting for my STI test, and now the building is closed. I feel like I don't have any other option."
Thank you, Chloe. And those are quotes directly from young people throughout the conversations. Lanita, let's hand it over to you. Young people spoke about systems of power and patriarchy. What did they draw on there?
So young people highlighted that even before the Dobbs decision, access to abortion and reproductive health care services was not always promised for girls, young women, and gender-expansive young people of color, who are also a part or could be a part of low-income, system-impacted situations, living when in a mixed status family or living even on reservations. These challenges were already visible before the decision was made. After the decision, it only made abortion even more unsafe and inaccessible to people. Participants also highlighted that the image of men making decisions on women's bodies were very triggering. And this is the reason why we would see the patriarchy coming through in these decisions and in these matters. Young people also feel like they have to advocate for themselves when speaking with even their healthcare providers to ensure that they receive all the information they needed to make informed decisions about their health. Participants underscored that Dobbs' decision disproportionately impacted low-income people who were already unable to afford the travel and receive the necessary healthcare services that they really feel like they needed. This is the reason why people overall felt powerless when needing to assess reproductive care during this process. I would now like to share two quotes from the Minnesota and North Carolina conversation that really encapsulated the themes of power and patriarchy. "I'm a Native American. I live around a lot of reservations, and it's really hard to access, reproductive care up here or even abortion access. Even being in Minnesota, where it is pro-choice state, but it's really still hard to get abortion when you live on reservations. I see a lot of teen pregnancies, and I wish there was more accessibility and affordability for us. From a Minnesota conversation participant. This quote that I'm getting ready to read is from a North Carolina conversation participant. There is a rise in maternity mortality rates in my community and the financial well-being and development of the children that resulted from being unable to access abortion. The economic hardships that disproportionately impacts women of color are devastating.
Thank you, Lanita. Addison, criminalization came up quite a bit in the research. How do young people think about the intersection of reproductive care access, surveillance, and criminalization? What did you hear?
So during the conversations we were having, we noticed that a lot of young people talked about their private data being used or targeted, and like those, and with that, the possibility of arrest being kind of increased and kind of nerve-wracking. It a lot of youth would use like period tracking apps and things like that to keep track of their menstrual cycle. But because of this new surveillance, they were a lot more afraid and nervous to use those apps because they were worried about what could happen to their data. And there was in the conversations we had with Alabama, there was a young person that had said like they have a period tracking app, and they were worried like some of the questions that they asked was like, what about if I forget to track my period for 1 week? Since they live in a state where abortion is banned, they were wondering if they could be targeted for the report, or why, or do they have to be forced to go to court and explain what was happening? And so for them, they quote said, it's scary that one small mistake can lead to a scary situation. And that was it's terrifying when you're thinking about, seeking abortions or seeking reproductive health care with, being reported to the authorities. You're just trying to get the care that you need, and there's this fear that you could be punished for it. And there was another quote from the conversations in North Carolina where many folks had doctors or midwives that were being reported and having to stop providing those services. And so people who couldn't afford those services would have to figure out ways in order to get an abortion. And that doesn't mean that it'd be safe. And because of that, a lot of them might have complications and have to go to hospitals and explain that. And that fear of what's going to happen if I do this in the wrong way, and now I have to talk about it. Are the police going to be called or reported? And so it overall, a lot of the youth would feel really surveilled and ashamed to talk about their reproductive health or whatever that might look like for them. So that could include like abortion, but birth control, Plan B, and other ways to help prevent or help them in any other way. So it really did create an environment where young women, girls, and gender expansive youth are scared and fear that just one thing getting something they need could result in jail time. And that's really scary for them.
Absolutely. Thank you so much. As always, please remember to use the Q&A function if you have any questions and after any section that we explore, including the themes. Chloe, it was clear that the Dobbs decision had a ripple effect. It didn't just impact healthcare and reproductive care decisions, it impacted other aspects of life, as we heard throughout. What did we learn here from the data?
Well, as we mentioned earlier, bans on abortions don't stand in the way of abortion, stands in the way of safe abortions, but it also stands in the way of the pursuit of young people's dreams. Young people are afraid of making life-changing decisions because they don't know how relocating can impact their access to reproductive rights. One testimony that stood out to me in particular was a young person was debating if they should attend their dream school at HBCU in the South because of abortion laws. And the quote says, "I also plan on going to an HBCU after graduating this year, but with everything going on in the South, I have a sort of anxiety to do with anything that involves leaving California. And I think that's something that like really resonated with me as well personally, being from California. I think sometimes we have this view of like, yay, we live in liberal California, the grass is greener on this other side. But it isn't. I think that this change, the Supreme Court ruling has really just had such a dramatic effect where people are afraid of pursuing their dreams, pursuing long-term career goals, the schools of their dreams, and feeling like they have to stay in their home state to preserve their rights. This quote says, I think especially being in California, our laws haven't changed in the same way that other states have. And so in order to keep that freedom, this makes us feel like we are bound to stay in California to preserve our rights. Yeah, thank you.
Of course, lots of implications. Lanita, building on that point, let's talk about the slippery slope, right? How did young people think that this decision would impact other rights?
Yeah, so overall, it really made young people nervous. It made them very uncomfortable as well, because this decision established a precedent for other courts or our lawmakers to continue to push agendas that infringe upon our rights that people really fought for. So yeah, it made it really difficult. Young people now have like a false sense of security over everything that they once considered settled law. From birth control to Plan B, they are really now questioning decisions. And it feels like it really opened the door for other reversals. This idea that a right can just be so easily taken away was really jarring for a lot of participants. And it just really felt like our country was going in a complete regressive direction. During conversations, participants also mentioned that what the Associate Justice of the Supreme Court of the United States, Clarence Thomas, said in response of overturn of Roe v. Wade. He mentioned that how other historic and landmark decisions needed to be reconsidered, some including Brown versus Board of Education and any decisions that made equal gay rights protected under the Constitution. Young people are now really fearful that this, meaning the overturn of Roe v. Wade, was a catalyst of a never-ending slope of regression in our country.
Thank you, Lanita. Going back to you, Chloe, mental health was a clear and pervasive theme throughout the conversations in the report. What is the connection between reproductive health and mental health as discussed by young people during the conversations?
Yeah, I think first and foremost, it's all interconnected. Wellness and being able to have access to the physical healthcare that you need directly ties into and impacts your mental health just for anybody. But I think specifically in the study, we were able to discover that girls, young women, and gender expansive young people of color in these conversations started to feel hopeless towards the future and developing really cynical views, unsure of how to seek reproductive healthcare information and services. Again, that fear of being criminalized or being surveilled. And I also think that the threat of there being kind of like a domino effect of negativity and regression really creates a sense of tension and anxiety. Participants also reported increased levels of anxiety, depression, and stress that has impacted their sense of self and direction for their futures, impacting almost every aspect of their lives. I also wanted to name very quickly that I think it's important to mention, add a context, that this is directly following the COVID-19 pandemic and all of the anxiety that follows. So for us to be stripped of kind of like the our social norms and the autonomy to leave our house at our leisure, to come back, do you know what I mean, to closer to the norm and face such a devastating decision, I can only imagine has astronomical impacts on young people's mental health that we can't quantify or foresee. But young people have also expressed a feeling of a loss of control over their bodies and their lives.
Absolutely. Thank you so much for uplifting that. Addison, can you say more about the information gap that young people spoke about? What does access to sexual education and reproductive care information look like?
Yeah, so I think well, a quote that I want to start off with that kind of helps talk about the point I want to say is like there was in the Mississippi conversations, a young person said, I feel like the services are hard to find. You have to like really research, ask people, ask the right people for the information. And I think that the reason I wanted to highlight that is because a lot of youth are using like Google or social media to find really important information. And so they're trying to find that information for themselves, but it's really hard when you don't really know where to go or what to do or who to talk to. And so when they're looking up information, they might be getting the wrong information from the wrong services and or sources, and they don't even know it. And so they're really trying to find in a way for themselves how to find that information. And because of the overturning of Roe v. Wade, I think it's really increased the fear and the culture of fear and stigma that surrounds reproductive health care information. And so it's really stopped people from having the conversation openly and honestly. And it was already hard to do that before the overturning of Roe v. Wade. So now it's even more difficult because of the ramifications that people might face. And so when young people are in schools or in their workplaces, they don't feel comfortable talking to someone because they're not sure of, that person's feelings or what their stigma might be around getting reproductive health care. And so a lot of young people are being left in the dark around this information, and they're not really sure where to go or who to talk to. And I think another quote that's really important that I want to highlight is that a young person in our Idaho conversations had said, it's kind of scary because, oh, I want to access reproductive health care information and be more informed on my body and the choices I have, but it also feels like but it's also like I feel a little scared because everyone's watching me and it's like they're going to target or judge me for my decisions. And when making such a really big decision for yourself, you don't want to have this weight of, okay, what are other people thinking? Like, what are all these other factors that I now have to account for? And so I think it further creates this gap of education and accessing that information that people need. And because of, especially in schools, sexual health education is already, a little bit iffy. And so this just furthers the curriculum not being inclusive of reproductive health and giving the youth the information that they need in order to access reproductive health and the information that would be helpful and not harmful to their health.
And thank you so much for that, Addison. So this is a question for everyone. What is the vision for the future? What did you hear from young people in the conversations? And what is your personal vision?
Well, I will start. Investing in building a pipeline of girls, young women, and gender expansive people of color, leaders across public service to increase representation. But I think even beyond representation, for people to adequately advocate, they do have to represent the figure of people and the demographic of people that they are representing. And I think that within the overturning of Roe v. Wade, as well as so many other policies and decisions, I think that they disproportionately impact young people of color, specifically girls, women, and gender expansive young people of color. And the representation of the decision makers that are making these impactful decisions does not adequately reflect. So that's my personal vision, is having young people of color, gender expansive, women and girls in government and public services.
I would like to piggyback off that. So the vision that young people stated that they feel like is really important was to create more opportunity for dialogue and community building. By doing activities such as that, we're offering platforms to young people to really speak their mind, and that in itself will allow for redistributing power by acknowledging their stories are valid. We what they are going through is real and interconnected within their communities. My personal vision is getting our country to a place where reproductive justice is not a political talking point or issue, but a fundamental right that everyone has access to. It would not be talked about in discussions to evaluate constitutional validity, because there would be just this conscious understanding that it's a natural concept that people will eventually partake in. Kind of like there's no constitutional law that we all can drink water. What is the point of that? It's just this natural thing that everyone has a right to and that we don't have to fight over.
That was powerful. Thank you, Lanita. Chloe, I see your hand up.
Yeah, I'm so sorry. Previously, I had stated one of the points that young people have made, but I had phrased it as my own because I just really stand by it and believe it. But another vision, like my personal vision for the future. Can I actually have you go to Addison first? Because I was so blown away by Lanita's statement that I need a second to collect it again. So come right back to me.
Absolutely. Addison?
I got you. I got you. So one of the visions that young people had shared, one of them was the attention, calling to attention the connection between electoral power and lawmaking. And many shared that we need to elect leaders who represent our interests and hold all elective officials accountable to the communities that they serve. And with that, I think for me, something that's really important is having the people who are impacted involved, because a lot of the times, like we talked about it throughout the conversations we had, is that it was people making decisions about bodies they don't understand. And so because of that, there is this gap. Like, how can these people make these decisions if they don't even know what the decisions they're making and what the impact of it is? And I feel like it's really important for people who have voting power to listen to the people who don't, because the people who don't are the ones who are being impacted just as much as the people who can vote. And a lot of the times, young people's voices who aren't of voting age get silenced. But they're the ones that these curriculums are affected on. The curriculums that they teach in schools, they don't get to vote on what curriculums they get to have taught to them. They don't get to be included on what that means, what that looks like to be taught about reproductive health. They just have to listen to what people are telling them they need to learn, even if that's not congruent with what they're actually feeling. And so I think it'd be really important to ensure that, to keep this point, the vision that youth have of making sure that when we are making decisions, because now that I'm of voting age, my vote isn't the only, like when I vote for me and anyone else who can't, because I'm not the only person that's going to be affected that goes when I go into the polls. I remember when I was in school and when thinking of all the politics and things that were happening, I was like, I have all these words, but I have nothing I can say, because who's going to listen to me if I don't have voting power? But I'm listening to them. I know that their voices are important. So I think that we should encourage and continue to have conversations with young people, making sure that they're in the forefront, because when we make decisions, they last for their lifetime, not just our lifetime too. So I think it's really important to continue to hold elected officials accountable. Hold elected officials accountable and make sure that they understand that their decisions don't affect just the 18 plus crowd, but the folks who are 18 and under as well, or 17 and under as well.
Ooh, okay, Addison, I know that's right. One of the cycling back, I had to write a note down to myself. Wow, again, I'm just like blown away by that point, especially the closing. I think for me, my personal vision for reproductive rights, I think that primarily, I think that there needs to be more research surrounding menstruation, pregnancy, and childbirth, pertaining specifically to women and gender expansive people who are carrying children, because so much, if not a majority of the research is surrounding really only the children. I feel like the way that we as a society conceptualize the process of like childbirth is almost like it's very one-sided, and like in many ways, in my opinion, non-consensual, especially with the overturning of Roe v. Wade. I think that it is dehumanizing the way that women and gender expansive people are thought of to be just carriers of children and kind of not, I feel like in society, we don't prioritize like postpartum care or childcare or supports for parents, but we are attempting to almost like legally hold people hostage within motherhood and parenthood and carrying children and bearing children and raising children. And I think that even outside of laws that directly impact reproductive care and access to abortion and reproductive care, there also needs to be an emphasis and progress in policy and legislation that is prioritizing women and gender expansive people and the overall quality of lives of families. I think that when you are pregnant, you are thought that you have a role, you are responsible to birth this child, but after that, where does that care go? And I think that having policy that creates support for families and postpartum mothers is absolutely imperative.
Thank you so much for those visions for the future, for the motivation that you've all provided and the inspiration. We're getting close to the end of our discussion, and before we try to close out and open it up again for any additional questions, we do want to uplift some words from one of our fellows who was unable to be here today, but did a fabulous job in their contributions to the conversations. These are Salam's words, and I'm going to try my best to do them justice. Facilitating the In Solidarity reproductive justice conversations last year had a huge impact on me. Throughout the process, I was amazed at how many young girls and gender expansive young people came together to speak about the overturn of Roe v. Wade. National Crittenden creating a safe space for them to discuss was a powerful thing to witness. I was saddened, though, that so many participants were unable or didn't know where to get information on their bodies and reproductive rights. Hearing young girls and gender expansive young people say they didn't feel safe going to Planned Parenthood anymore because of the protesters was heartbreaking. I was more than sad, I was angry. Angry that we even had to have this conversation. The fact that there are stricter regulations on a woman's bodies than guns is not only disturbing, but it highlights how deep misogyny runs in this country. I'm hoping that as a result of this report, community leaders and elected officials will wake up and do better. Our generation deserves better. So why are we here? What are we doing? What's the next step? We want to go ahead and do a call to action.
So as you take time to digest the information from today's webinar and the RJ report, let's center ourselves by asking ourselves a couple of questions. How can we continue to build back reproductive rights, health, and justice in a post-Dobbs world, where girls, young women, and young people of color are in the discussion? Let's think about how they are being censored in the broader women's rights and gender justice movements. Let's also think about what policymakers, decision makers are doing to consider young people's experience. And also think about what groups are we still excluding from the conversations and what solutions we can build to propose to engage them within those conversations. Let us form these partnerships and participate in collaborative efforts that build bridges to solutions by spotlighting young people and their stories. Let this be a time where we can listen, learn from the past by building better futures with racial and gender expansive lenses and invest in these efforts.
Thank you so much, Lanita. Before we close and we conclude with our contact information and additional space for questions, we do want to provide space for a very special contribution from one of our fellows who also could not be here, but Chloe will take the time to read their poetry.
Chloe, you're on mute.
Sorry, I was just saying, if I get choked up reading this poem, forgive me. It's absolutely beautiful by one of our fellows, Genesis Holland. This poem is called Am I? Sometimes I don't feel like a human. Instead, I feel like a creature, teeth gnashing on the bones of inequality, swallowing down a bitter pill and being told it tastes sweet. Like a fool who should be thankful to be graced with the nutrients of deceit. Sometimes I don't feel Black. Instead, I feel like a tragic footnote, one made up of all the histories of those who came before me, shackled in invisible chains, given by the universe under the guise of precious jewelry. Sometimes I don't feel like a woman. Instead, I feel like a coffin, made to hold something far more precious than me, made to be shiny and new, buried, forgotten, and used nonetheless. When I lay on my back underneath the crest of gentle wind, I fantasized about a place where I would feel none of these things, where I can be Black, a woman, human, not a footnote, a creature, a coffin. Some simple little idea capable of being silenced, I'd be the essence of freedom. Free to be everything, free to be nothing. When I open my eyes, the wind becomes uncomfortable, harsh on the face of possibilities. I think in realities. If the sun set forever tomorrow, and if the ocean ceased to move, and the air became lead, I would want the shadows of existence to remember, even with stitched lips and bound hands, that I will scream sonnets, move mountains, and shake the very earth for our unalienable right to choose.
Thank you, Chloe. That was powerful. You will be able to read this poem as well as other contributions from our fellows in the report. Before closing, we do have some questions. The first one came in, and I hope we answered it throughout, and it was how many young people were involved in this work. We had over 115 young people join the conversations throughout the states. There were 8 fellows that participated, facilitated, and led the research. The conversations were small by design so that it could be an intimate setting where folks felt comfortable in sharing and opening up. And you can see some of those numbers where they came from in the report. The next question is, I would like to know if the law prevents abortion based on medical conditions. We're typing the answer there on the chat, but we will also like to remind panelists, participants, that each state is different. The language can be a little bit confusing, and that can sometimes be by design. So we encourage you to continue to seek out information, but really pay attention to what's being said, as it is different state by state. The next question: what were young people's perceptions on using social media in online forums to develop reproductive healthcare education and information, while also balancing the fear and likelihood of these sites being used for surveillance? And anyone could take it away.
I would like to start by saying, great question. I would also like to say that for me, I do think it's a little bit different because I am from California personally, so I am not in a super restricted state. However, one thing that did come up for me while exploring this work was asking myself, I know that throughout the report, there were young people who have expressed like a fear of doing research on the internet, especially social media, because it's unreliable information, and it's hard to detect whether it's a reliable source or not. So I think that was a huge factor for me. But additionally, I know that on my personal social media, when I get really into an activist cause and I start to post and make my voice heard, I experience being shadow banned, which is where my post cannot be found unless people search my entire username and already follow me. So my perception is not necessarily a fear of being surveilled, but also actually being silenced through these shadow bans, through the words that I'm using, kind of being flagged and tracked to kind of put me under the radar, because it makes me feel like I cannot adequately supply resources to my community if I'm choosing to also speak out about things that I think are wrong, that I will potentially lose that platform to people who need access to the information and resources that I have.
I would also like to piggyback off on that. Misinformation was definitely like a sub theme that came up during these conversations. People were really wondering, where can I get the best accurate information? And during the conversations that I was a part of, there was this shift of not necessarily utilizing social media, but making sure that there are instances where we can go to reliable sources. But the framing question was, who is a reliable source? What is a reliable source? And how we really need to get to a point where we can invest in people being reliable sources. So we're not looking on social media and we're not being targeted by crisis pregnancy centers. I know I'm saying that acronym wrong, but we're not being targeted by people who are trying to demean people from accessing abortion rights or reproductive health care.
I'd say from for me and the conversations I was a part of, there was a couple of states that stood out to me that a lot of them had the same issue of like trying to figure out what a reliable source is, but it was almost as if their want for information, even though there was a fear, overtook the fear of getting in trouble or being surveilled, because it was information they really needed. Like, they were scared. That doesn't stop that feeling didn't go away necessarily, but the way that for them, the way that they would balance it is like, how much do I need this information and what am I willing to do to find it, with that fear in the back of their head. So it was challenging, because they want to have information, but it's that, again, like, what is the information they're looking for and what's correct and what's not, because a lot of folks, like, the things that they learned or heard or the hearsay about what abortion sounded like, things like that, it made them like, what do I look up then? Like, sometimes I didn't even know what to necessarily look up, because there might have been a challenge of, what is the what information is right and what information is wrong am I looking up, and then how do I figure out the right way to get that. So in some ways they were still willing to use those platforms even with the fear, but it's just that need of finding information. Like, it's kind of like when people say, like, young people, they're going to do what they want regardless of what other people say. It's like, even if the information isn't accessible, they're going to find a way to find the information. And so even if they're scared, even if they're not sure where to go, it doesn't stop them from wanting to find it, even if that fear, considering everything going on, that being there, they're still needing it and wanting it and figuring out their own ways to circumvent the fear of being surveilled and things like that to get that information.
Thank you so much, everyone, for taking part in the discussion. Thank you so much, everyone who attended, for your questions, for your participation and your interest. And we do have a few minutes, and I'm just tossing it out to the group. Are there any closing remarks, anything else that you would like to say besides our call to action, besides raising awareness of the fact that young people need to be included in this conversation? But wanted to toss it out there before we actually close.
I would just like to say, if there are any adults viewing and participating in this webinar, I'd really like to encourage having really open dialogue. I think that young people have expressed a need for knowledge and support. And I think that sometimes, especially as we are, so deep into this like technological era, we forget the power of like connection and word of mouth and sharing knowledge intergenerationally. And I think that having open dialogues about like what resources are available in your communities, what care services are available, like how do you take care of yourself, I think are really important things to be having dialogues about. And I really think one of the most insidious forces is the fear to speak up. And I think that we see that in so many capacities. And I think that in a lot of ways, I think that in the long term, things, when we see things regress, a lot of it is because a lot of the reason I think that when Roe v. Wade was overturned, we all asked our questions like, how did we get here? And I think a huge part of how we get there is not speaking up and not hosting these dialogues. And when nobody's talking about it, it's easy for sneaky decisions to be made. When there are taboos there in society and in communities, there is room for us to be disempowered and deplatformed because our voices are extremely powerful and healing to one another.
Thank you. Okay, well, we thank everyone for joining us today. For those of us who will be viewing this later, or if you weren't able to be here and are going to be accessing this webinar later on, we are posting our contact information. Please feel free to send us any questions or comments regarding the report, and we will be happy to connect with you all. Have a wonderful rest of your day, and thank you, everyone.